In response to an increasing number of patients requiring hemodialysis, in 2010, the government of Belize signed a Memorandum of Understanding with the World Organization for Renal Therapies, WORTH, the Carl Huesner Memorial Hospital Authority, and La Loma Los Adventist Hospital to provide quality hemodialysis services in Belize. With the support of WORTH, 8 hemodialysis machines were brought into the country, 4 to KHMHA and 4 to La Loma Los. That initial program provided 3 free weekly dialyses to 30 patients with end-stage renal failure across the country. And a recent decision by Cabinet will now see that number raised to 88. As announced by the Acting Prime Minister, Honorable Patrick Faber, in his Independence Day address, these patients will now receive 2 free weekly treatments, and that promise became a reality after a contract signing ceremony on Monday, October 8th, signaling the expansion of the hemodialysis program. At the ceremony, Minister of Health Honorable Pablo Marin spoke of Cabinet's decision to expand the program.
It is saddened that we had so much patients out there and we weren't able to help them. And I think that the ministry, my CEO, my DHS, we were working along trying to find a solution and a way forward for us to be able to help all those patients that are not getting the dialysis service. We have about 50-odd patients more out there that are not getting the dialysis, and we brought it up to Cabinet. Prime Minister and my Cabinet colleagues agreed for us to expand it, but yet with the decision that we will have to remove one of the dialysis that we are giving to the patient instead of being 3.
Among the improvements to the program is the addition of 2 new service providers, Miguel Rosado Dialysis Center and Dialysis del Caribe, for a total of 4 providers. The patients will receive treatment at the center closest to their hometowns. KHMHA will continue to cater to 15 patients, while La Loma Los will receive an additional 6 patients for a total of 22. Miguel Rosado will serve 16 patients, while the remaining 35 will receive treatment at Dialysis del Caribe. The Director of Health Services, Dr. Marvin Manzanero, explained how new patients will be selected for the program.
There is a terms of reference for a selection committee. It is going to be purely on a technical medical background that new patients into the program are going to be included. We have had the case where you select a 15-year-old who has polycystic kidney failure and you have a 70-year-old diabetic and you only have one machine. What are you going to do? It's going to be a purely technical decision. So it's the same thing that's here. There's a terms of reference being drafted for that committee that will include technical people sitting and making that decision whenever you have to make that unfortunate decision.
Present at the signing ceremony was Ruby Nicholas, representative of the Belize Kidney Association. Nicholas spoke on the financial relief brought on by this move by GOB.
The cost per patient will be minimal. They will be able to now focus on other health areas, because remember that dialysis is only one component of their health. They have to deal with medication, transportation, food, dealing with their family care. So this dialysis, having them covered, the government covering 2 dialysis, will be of great assistance for them. That in itself will allow the patients to be able to have a guaranteed dialysis for themselves. That will also give them longevity, and their concern will only be now to try and get that one additional dialysis. So we applaud the government of Belize to have considered that initiative.
For Belize Now, I am Janelle Mencius.